kind of cool. I've got Isabelle here, and well, first of all, Isabelle, what patient number are you?
2971.
2971, guys. We're up to 7,500. So Isabelle's been. Do you remember how old? But how old do you think you were when you first started coming here?
I started coming in here when I was in 2013, so since I was 13 years old.
Yeah, I've got it, and I've got to see you grow and become this awesome professional that you are. And she's quite an athlete too. So, why did you really start coming here? What was the reason?
Well, I was 13, so I was forced to be here.
Yes.
I played a lot of sports growing up. I played college softball, so I was playing sports year round. So my parents thought it'd probably be a good idea to come in here, make sure my body was in good health, and then I continue coming on my own now. I'm not forced anymore.
Let me ask you this, because I was talking about this. When I have kids, and you guys remember this too, kind of I mentioned before, now Isabelle was a little bit older at 13, but when you have really young kids, let them be in control at first. Did you feel comfortable around when you were first coming as a kid? Because I know a lot of times, especially at that age, you're like, all right, I don't want to go to the doctor's office. They're kind of nerve-wracking. But I mean, it was kind of easy first experience.
Mm-hmm.
Good.
Yeah, it was very welcoming.
Good.
Welcoming environment.
Even as a kid?
Yes.
Okay. And she's a heck of an athlete. How do you feel like chiropractic helps you on a daily basis with some of the stresses you face in your everyday job? Kind of speak to that a little bit.
I feel like since it's been about 2 years since I've done playing college softball, I think my body definitely has adapted to not being as active now.
Sure.
And so I think being here, it helps me be able to move my body differently than usual because I'm getting adjusted. And just with different health stuff that has came up with my digestive stuff, that definitely has been able to help where I'm able to maintain that more than being in pain all the time.
You keep things moving, but one of the ways we kind of make sure we're getting you guys educated is to have stuff in the room. And I want you to testify to this because when we were in there, I think I brought up ChiroMatrix and showed you where the nerves go to on the website. You guys don't know when that teaching moment's going to come, and so I cannot reiterate to you enough. And do you remember that? And that kind of clicked?
Yeah, because I'm a huge visual person. And so being able to show my whole digestive system all the way from the large intestine to the small intestine really helped me understand why I was in pain and what changes would help me to where I wasn't.
And to see the nerves, where they come out, where they go to.
Yeah.
You don't know how powerful this is. You guys listen to this, okay? Like, yeah, they come in for neck pain and back pain, but you got to take the time. Have that. We use ChiroMatrix where it's got the nerves that go in there. That was a key moment for Isabelle. I could tell even when we were in there. So just remember that. Cannot reiterate that enough. You've got to be able to keep the flow of the patients going, but also have the tools you need. It comes from preparation, just like in everything we do. What else have you noticed as far as education? If you could speak to that a little bit.
I definitely think that when I come in, I'm not ashamed of like what I talk about. Obviously, with the digestive system coming from a woman, it's kind of hard to talk about. But I come in and I know they're open-minded and they're listening to me, and I think that's huge. Is having a doctor who listens to you and takes your concerns into consideration and is willing to explain and take the time, even though there might be other people waiting or not. They take that time, so I don't feel rushed, and I feel like I'm important, and I think that's important. I'm excited to come here because it's a good environment. It's a positive environment.
It's so neat to think, like, how long ago was that? That was like 13 years ago, 12 years ago now.
Yeah, because I'm 24, so going on 12 years.
12 years ago. Just, I mean, what a blessing to have someone come in 12 years ago as a 12 and 13-year-old, and you're sitting doing this patient interview with me, and it's even just outside of neck pain and back pain and being out as you kind of get started in your career, being able to function the best you can. So, and then also the importance of having a good, energetic environment and taking the time to teach. I couldn't have said it better. I thank you. I'm so glad you've been with me for all these years. And you guys, I hope you guys get some great stuff from this. Till the next one. And Isabelle, thank you again.